What I like the most about Carline Auto Parts is that they don't just sell you an oil. They take their time to educate you on exactly what your car needs. And luckily, they told me about this amazing product for my car's transmission. Booster is the best transmission oil that you can find on the market, and take it from me. If you've ever had a transmission problem, you know exactly what it means to be in those shoes. So get the best product and save yourself the trouble. Call Carline Auto Parts here at East Legon. Call them at Dacoman, and bro, get yours. My sister, get yours. Don't waste time. Carline Auto Parts, your car solution.
Living in Ghana, abroad, a first-timer visiting Ghana, or a company wondering where to get quality service providers in Ghana for any job? Then Ajumapa On-Demand Services is here to assist you. Ajumapa On-Demand Services connect requesters and service providers such as masons, plumbers, electricians, auto repairers, home and office cleaners, trash collectors, rent agents, spa attendants, roofers, beauticians, teachers, CCTV installers, and all artisans on one platform. Yes, one platform. Trust Ajumapa On-Demand Services to sort you out any day, anywhere, and at any time. To download the app, please visit the App Store and Play Store or visit our website www.ajumapa.com.
All right, Ebusafo, time aso, me mama kwa about SBTV Africa, so safini with boy channel no so the voice of the community. And then Thursday 6 p.m. 6 to 7. Na odim say Thursdays biano me be dishing in komo Germany in komo Germany we day mo chile summer nyina mo Europe ni nyina mo chile summer no Germany for na Germany in komo number bidi na ye be hwe one or two things are very important. Onim say program we magacha mo say very educative nti se we ntie bia obelusu nyama bebre we nkutu aska wo bibia o ahaya de ma free nti we ni boss so na wa share link de ma onu bi for adwen kire bra na de obese obi se bia so betime bisa na me ni Aisha Aisha abejoin ne me ti na ye be hwe Germany mo health system then e so hu fa ho nti e ba be bisa questions Aisha so ba be educate yen nti me ni Aisha a social worker and also say immigration expert nti ma me ma na kwa ba Aisha me ma akwa ba boko de
boko
Germany we dey, that's right, Germany we dey. Na also then somebody then echo one shot was in there, was a draw so we go anyma say one man from fam season aye ja the biu
be for freedom abaya
and check you bet you much a cage num biom I want be samba na mu nyina sa mo shada na mo di renren ni nyina no ye hu biom you be say hu biom this next year it is
na wasi
ye last no bro nya atade no hye no prekum say na wa fa ho a wa hye long short way me hwe eko September mu oko nya for bia kukuru anyway busia obi awe
bibia boko nyame adom
nice one. And also you share then a problem about health we are say educating crop for very important Germany.
Yeah, I think so, yeah, generally no, it's good to know how the health system works because I think say almost Germany and Kasano they wonder and they have concern. Hey, my hero. Asayaba. Patron. Okay. Inti more concerns about how it works because obiane story I think that won't has ya obiane story I think that that's how it is everywhere. Obiane story or catch on my so I thought say maybe we should educate people on it how it works because if we say and go idea so just to throw light on it and so generally
okay it's fire go through about more health system no ebia obi wo ho a onim owo dada obi wo so a wabetena afa na wabetena ho nti momra no kosan breaking down nti mejama nti over to yentie mo health system.
Okay, so generally first things Germany has here health insurance is one of the first things Of course, so would you visa now? Usually before being a visa, and the Krambeka say yeah, travel insurance now, but that's the travel insurance I usually pay, which is around which shouldn't be less than 30,000 euros travel insurance. It doesn't mean it's 30,000 cash, but you know that's how it's. You have to do this before you get the visa to come, just in case of any emergency. You know, that's what and not able to take care of you, like cover it. However, I'll be do has any via, then you would have to change into the your friend gesetzliche Krankenversicherung. In English, we can say that's like buying the government health insurance. I'm afraid. So then you would have to change into the health insurance. Depending on how I will buy. So as a tourist, of course, you don't need this because tourist visa there, you're coming for just a very short time into travel insurance in the Caval during the time you're here. If you come here as a student, more as a student, usually you would have to pay by yourself. So insurance, no, yes, but it's subsidized. The amount of sika will be to you at the end of every month. It also depends on how old you are. So as a student, then you'll be paying it every month. I think that it's not so much. I remember those days when I was a student, no, it wasn't, I think I didn't even pay up to 100 euros a month. That means like I said, it's subsidized. It's too just away, but you can access everything when it comes to the health insurance, right? And like the health system, which access everything. I think when you get to the age of 30, then you would have to pay more because I think after 30 years, no, 30 as a student, no, then your subsidy, like it will still be subsidized, but not so much. So then you'd probably have to pay more. So that's for students. If you came here now, but the family reunion by 2 bed, depending on the situation of your husband or wife, no. So yeah, Juma no insurance, then you bet me join because in the beginning no 1 year Juma to be joining as family member, so to be a family insurance. So who couldn't need and then they put you on it because 1 year Juma. Once you start working now you would say your own insurance, so you move into your own insurance where you pay. In Germany it works say if you're working, I'm talking about those who are working. If you're working with insurance, no, 50-50, it's placed at 50-50. To your gross salary now, yet insurance no but utia only 50%, and a nipana employer needs to 50%. Yeah. So yeah, that's how it is. But like I said, then you're able to access everything. So when you're Juma are buying to everything completely. I mean, of course, I said aside students, no. If you have a normal residence permit here, no, that will need Juma are buying it to the whole thing. Like I said, they're so subsidized that it's not so expensive in the end. Say, we'll be out here, Juma, say, what you pay? We'll pay slip now just so I'll be here yet too for health insurance. Usually, na be brave. Amount near to for example, say health insurance still 150 a month. That means employer needs to charge 150 count. That means to health insurance, utia 300 every month. It's almost split on half. That's how it is. In healthcare system in Germany, it works such a way. So like I said, everybody needs an insurance. No, I know. Say if you're comparing it to countries like the US, and I think say more government insurance name no are the poor. Those who can't not, I don't know if poor is the right word, like those who cannot really afford it, or say unemployed, and I say Nisika said I'm baby. I think so I think so those times so they had this Obamacare. I think Obamacare came in place for people like that. That was for a certain group of people, but otherwise no. The system in America, for example, no. Like you pay, the more you earn, the more you pay. Utia for health insurance. Whereas in Germany, no, it doesn't matter who you are, how much you earn. I mean, there's some exceptions which I'll explain later, but usually, no, everybody is insured, and you don't pay more. Untia and COB. It's not like that. So that's how the German system is. So it is Oba has saying now. First, you would need a card. There are different kind of insurance company if you are buying how I subsidized a bit. So I know so maybe Ghanaian community, most people are used to the AOKA. if a can your friend, most people are probably there, but it's not the only insurance. I will take car, that is a technical cranking casa, your Obama, your BK, so many different type of insurance. Obiane what should I say, what services are provided? Ebi providing more services than the others. Yeah, ebi more on my one ya maybe taking like 100%, ebi more so it all depends. Also, while you're research now, which how do you say, which insurance company provides what? Like I said, it's all under the government, so it's just the companies that are like working. It's not like for example, in the UK they have the I think NHIS or something. I think it's similar to in Ghana or National Health Insurance. Obia were the same thing. No, in Germany it's not the case. In Germany there are different types of providers for health insurance. No, until we check it, services on provide, then you decide which one you want to enroll on. Which one was it? Be more surprised, no, a defense maybe be a 20 euro cheaper than OB and OB a 20 euro more than OB. So you can look at that and then decide. So yeah, find out what Germany has a why are it like you sorry and a pound home file mutia yeah. So we obi a wunye juma. I think so then you don't, of course, we call Dr. Hona, Dr. Ashel, now about that. Right. However, Dr. now is the same thing. So we juma it's the same thing, but then the only difference is was our catch who employer say we are before no BBL no paper so your friend no say your sick leave or say more kind of sense so we are sick in your friend arbeitung fish kind special and in kind of saying yeah Krankenschein so you have more paper so paper now the more employer the number of days I will call leave because they have to know yeah but it says so maybe be electronic and say you know you don't need that paper like people are now adjusting most of the practice normal almost like doctor practice now almost adjusted to electronic in a few almost started that so in a few years now everything will be electronic and to call doctor when I say we area almost sick leave in fact I'm 1 week here almost forwarding automatically I'm our employer so you don't have to do anything you just have to call your employer and tell him say oh yeah no more doctor that's your job you have to do into now, like I said, card no companies no providing health insurance. So what card? Into card no na neko. Has say so you don't go straight to a hospital to say now because I'm hospital. Has say unko hospital. You could be a friend of practice. Into the infant said your general practitioner, the mobile friend your GP, or Ghana no, or one office, or one be able to say small clinic. Just any consultation into so utia ya was sorry na penalty ya ne ho na obeko o general practitioner no has your friend house arts now I show what our problem at channel now I show or show we and if the or no or unidi obema indro or say or throw time now was say they can say 1 week leave now I that till you recover if you don't recover you go back to them into almost offices now you go to them. If it's a case where like say a serious a year or you need further medical whatever, the amount transfer, this is when you go to a hospital. But they would have to give you a referral letter to go to a hospital. Say ma in June so in June now I have seen usually no it be say in June boy but the year for in June is subsidized. Just like offer our card now acquire question, you don't pay anything at all. But in Joby or higher trauma some are totally free and some are subsidized. So maybe you think send a boy but then you're not paying exactly the price that's supposed to be. It's subsidized by the health insurance. Into which you can create if the amount in journal. But for Nkola from ages, for 4 to 18 years, usually into most of the medication free. From then, this is when you pay the subsidized on it. Yeah, in case it's Nkofa, sorry, hospital direct. For example, like what's every weekend, a Saturday and a Sunday, because now we are own feel fine. You feel say I need medical attention as soon as possible. Then you would go straight to the next the hospital, a hospital that's next to you, because practices GP practice now. They are only open from Monday to Friday. They are usually not open during the weekend. That's why weekend during emergency there you go direct to the hospital. I'm sure was an emergency, right? No more sure. So your situation is so bad that we hear ambulance and you call the ambulance and then the ambulance picks you and then brings you to the hospital. Usually, they will not bring you to a hospital of your choice. They will bring you to a hospital that is close by in your vicinity. Maybe I would say no, they are bare no honey and overcome. Ambulance in Jessica, they don't charge for ambulance. Or card, into combat you details need be. However, so hospital, that's a situation here so how do you say bad or whatever, critical, that you have to stay there. What they do is that they would like the hospital for 1 week. You don't pay anything. You get food. It depends on what hospital you're in, but mostly the hospitals I know, it's 2 people share a room. Mostly, I mean, the ones I've been to that I've been admitted to, 2 people sharing or bed mate. Now more honum na show. Ma with you breakfast, ma 3 square meals. They be you don't pay anything. Discharge away we now coffee no. After says 1 week now, then they will send you a bill. But the bill, no, it's not for treatment. Like I said, you don't pay anything for your treatment. But there's something that we call pauschal. Meaning pauschal, like fixed price beer as everybody pays. It doesn't matter who you are, you would pay. And that would be for like for the hospital. Like the bed you're sleeping on and stuff like that. You pay €10 per day. It's usually once I the hospital 1 week. Like I'm talking for like but we are 1 I'll be here. So €10 per day, so that 7 days, and that's €70. And no trauma hospital, no, it has nothing to do with it's just for the hospital. But the health itself, the healthcare itself is free. You don't pay for it because you have your card. And so that's it. So that's just a €10 per day fixed a year for the bed. So that's it. What haven't I mentioned? So like I said, you have your general practitioner. So when you go to somewhere else, you have your optometrist or an optician. Into eye doctor on into when your baby or say skin problem skin doctor now office. So this is the first step depending on what situation you have. If it's critical, that is when you have to go to a hospital. But otherwise you go to the practice. For women, it's the same thing. You don't pay anything on it. You just take your card, you go, you choose your hospital. Usually you have to choose the hospital. You have 3 hospitals where you can register and tell them, say, okay, I would like to give birth here. My first choice, I think about 6 weeks to 6 or 8 weeks to introduce you. I'm a doctor, no. But before, the only place you go is a gynecologist. The gynecologist too, he's in or in the office practice. The whole time. And sana a big hospital. Now we choose hospital. So now normally so okay, say. So depending on your situation, if it's cesarean section, I'm going to say okay, date way na if it's normal delivery to a worker, why register at hospital now? You don't necessarily have to register in a hospital. However, it's good to do that. Now you baby but open so I'll be to me sorry last show. Now I just have a hospital. The only problem is sometimes the hospitals they don't have capacity. They say infant is a hospital when a person can register only a worker. They do time I will say now hospital where it's possible say they might send you somewhere else because need capacity for you at that point, because maybe I already saw at the same time, so they won't capacity could be for. So it's always better to register first. Even when register a hospital crown before it's possible say that now from say work say unfortunately, any capacity in the to baby for. It can happen. It happens. It can happen in Germany. It happened to me myself. And I think it's better to register early. You have like 2 or 3 hospitals that you've seen that you like, just in case. So that's about it. So, however, a ban of a friend is saying health insurance now. A binding now most of us that so we juma na say a month. If you're getting a salary between like between I think 5,500, what can I say, 5,500 to 6,000 euros monthly, you do not qualify for a buying if anything, a buying healthcare no. Now you do not qualify again. So for you, no, uji enough money. So you also called private insurance, private physician. They say, somebody like that, so if you are buying, you know, private DNA. The difference between private DNA, you are buying, so is that they don't need the card, need insurance card. They just go near show or your show movie and send your receipt. No, it's even say share for a day and you say yes sure winning now and say 500 euros. You best no receipt no for 500 euros no. Now wait to ya. Wow, do see kabetia? O do see to ya? So receipt no. Now I forward them our private insurance company no. Then they pay you back. That's how it works for private phone. No. But for government phone, you don't even know how much it costs because obia no nkesi kasem odo card ne come here, so you don't even know how much it costs you. But private phone, omo and here omo check because omo to answer na omo nisika back. So that's the difference between the private and another big difference is that usually I think Germany is okay, but depending on problem I want doctor no. Sometimes no appointments no it can take up to up to some people even up to 3 months depending on the time and what problem it is. But usually no, I think say between a week and a month no our appointments. That's if it's not acute here, like if it's not BBA houses here, they can always walk in because there's a walk-in hours as well. But you find say, oh, BBA my skin or a here, need the appointment or for if anything skin dermatologist or something, or from or bit okay. The next appointment I can give you would be in 4 weeks, for example. So you would have to wait till then to go and see them. However, on more private, usually you don't have to wait because TSC can yes any receipt I'm a TSC can into to me a friend then we need appointment in there. So that's I feel say in that case it's a bit biased, when it comes, but they are paying almost special almost practice almost special waiting area different from you are buying the NSON. But if you don't know about private, then you don't pay attention to it. But usually that's how it works. In terms of and I have seen I think say Ajumapa are buying police phoning in private no buying the because I think say almost special cases until more on them. Not kind and that government the so what haven't I said? So basically that's how the health system. I don't know if there are any questions then of and I'll be then can gladly ask them.
Aisha that's it. Social live and streaming live and the Mako Facebook for so kakra or YouTube and our Facebook page. But more Facebook and more try na more join our YouTube channel so SVTV Africa. I want actions no pa inti. And then me try say my just kakra say the Facebook. Two questions be up so bisa no. If problem be our film and say bibia waka so far na the on kind ya no questions be up so bisa no bisa no we sua there. Into more Germany no and our plans so called Germany we nyina so hu I asylum for no obi eduro ni ade no so mo so
so what bahasi no wa register why you be was so you would edura o register you filed fingerprint ni bibia no automatically no Abino is in charge of you for your medical, for your health insurance. Automatically, or call hospital baby or baby a buying take care of. So far as water a road process name or a buying nature or insurance. Yeah.
Wow. Anything amutia more taxes than we do say and you free so as okay. Sending taxes.
Yeah. I mean in
Okay,
the end, of course. You have very high tax. Like I think we spoke about up to 45% or even 50% of tax in Germany has say. But that's how it works. Tax it goes back into the system. Health insurance, care, most of the times. Pension, money in the end. Yeah.
I see. Yen share we mu side this way. Single parents no so eh. Nkola side ni ade no yen share no so eh.
Okay, so you're a single parent, like I said, it depends. So we a single parent, you won't we are Juma, that means one person na wutia for insurance, right? That means wutia 50% and our nipa na we Juma or employer needs wutia 50%. Who bar banning in that health insurance. So usually in Kolano cry omuntia. So the wutia will not change. The wutia for yourself will not change, but umbani kolani babe daso. Inti almost one meeting call hospital ni be without any problem. So one year juma abai nitia, but abai ni betia ma won in kolani nanti saying you can unya will healthcare ni be without any problems. Yeah.
Wow. Na manyare the whole year ni ana 2 years ni 3 years o mema miske bia na.
Acho that. That.
What you the tax and insurance manyare so eh. Scanashi.
Ashe.
But talking about I say obi say question me by about ambulance so why explain ka cry krobi wa ambulance be fa ko ni ade from no be fa ni ade a utua ni o betu ambulance betu ambulance charges anamebwa but Germany they are free.
Germany won't share for ambulance. No. So far as Owa has say, what has say, yeah, on health insurance, what has say, you don't pay anything for ambulance. Or from more address, what's the nature of your problem? In the next 5 minutes, mobile be do about the that's it.
Wow. And our health system charges also the same. Mobia and akotia OJ.
I think it depends on here OJ, but it's not so much. The OTIAPA is not paying more than 8 to 300 euros per. No.
I see.
No.
Okay, it is a more questions here. Mumbisa and answer upon we and show. Obviously, Mumbisa way.
Maybe you can also talk about the France Carter, because at where I live, I keep telling people to go for it. So it's as if many people don't. What about it exactly? What should they go for? That I'm trying to understand what the person means. Can you please explain further? What do you mean? What do you mean they should go for it? Because I know everybody has a health insurance, and everybody would just go to the hospital or card inquire. You would just go to the hospital and be taken care of. Of course, there are always, like I said, certain exceptions. It may be 100%. Like for example, an example would be for uko dentist. So uko dentist for now has say you don't pay. I know in other countries like UK you would pay something for your, even though or other NHIS was still will be for Waseno. I say you don't pay. Your regular checkup is here. Once a year you should go to the dentist. This is what's there. If you go to the dentist, there's a paper it could be almost signed. So to me, yes, for 10 years. Now say we'll see need some very big operation usually because work regularly now. You won't pay for it. Otherwise, no, so we may see some of the things they'll ask you to pay for yourself, because one hour you know what I'm that's how it is. And so person we be will say when I pay and fancy be most more your teeth whitening or say why no. And no, it has nothing to do with your health. When our person was saying white and well bit yeah, for example. So usually for things like that, when people have extra insurance on the side that a cover, but a little bit that is out of the health insurance name. Yeah. But but otherwise usually no, you have your card, you go and they take care of you. That's it. You don't pay any bill. So
It is a local hospital now. A can year baby 10,000 or 20,000 euros. I buy any befani na.
It's not your business. No.
Oh, okay. Okay.
Card. So far as what card now, so a major operation, whatever, it doesn't, and your business, no matter how much it costs, there be what the card and it doesn't matter. It will be taken care of. That's it.
Yeah, I'm sure more about stories and so.
That's the thing.
I say insurance be covered. It is about stories. I bet you me all of a sudden me buy next day and not 2-3 days me feel okay near the then I'm be show insurance when I'm trying na.
Yeah. So as a tourist, no, because we travel insurance, no, because you know you're a tourist, won't carry your health system no, because you're coming for a short time and going. Into Nayama we yes travel insurance. No. So if you have in case of any problems, no, the problem here and then they say, Oko hospital, I'm about show. But then no, they would need a place to send the receipt. In most cases, no, won I will bet yes, kana oyare no. Like Coco Hospital could do, you know, say if I say 10,000 euros, one I'll bet you 10,000 euros in the first. Wait to year, no, now what you receipt, no, so I'll come back to Chrome Ghana. Baby, I will try health in travel insurance, no, up to 30,000 euros coverage, no. One I'll produce, that's how it works.
Hey,
yeah,
sir,
that's how it works.
Now, say I can't go do 5,000 and me need one me.
You know, the thing is that usually no mobile show, but they will find a way to get back their money. Because Germany, the law they say untimin enja will be money. We a doctor in here you be bar ubesheno. Yeah, because it's a wujani pano why you have a problem into a mobile, but they would find a way to get their money back. Into now bad stories, I see any more details now. Hotel out here and Nipa hotel in China, why they will find a way to get the money back. Yeah, but that's how the travel insurance works.
Wow. More questions beyond baby sana na and I'm okay. Say I'm okay dear. And me shall no be bisa question be am say. And then for health mo. So you the Aisha for we say many question be on the health there in same way.
Hey, some US senor. Is it possible to have work permit as an immigrant? So here with USA green card. Green card now, I think it's a green card, it's a permanent residence, right? I mean, I'm assuming that's the whole
green card they say a resident, say a permanent,
okay. So permanent. If you have the green card and you want to come here and work, it always depends on your job. Like I said, usually you would have to get a job first to come here, because I'm assuming once you have a Ghanaian passport, you would need a visa to come to Germany. So Uber has said that you would be a tourist, right? But once you have a job, then you can come here and get a work permit and work. Yeah.
Okay. For now, no. I think so. Matthew no choice anyama we know.
That's Matthew. It's Matthew here about the reference card. Sometimes some medicines you will be asked to pay some little money before they give it to you at the apotheke, but if you have it, they will waive it off. This is what you mean with the reference card, and that's what I think I mentioned it earlier on with the medication. It's mostly subsidized, yeah. But then in that case, no, of course, you are not working, so you cannot pay. Then that's when reference card plays a role. This is when you would need it. But otherwise, for people who are working, no, they don't need any reference card because they will not get it. Because it's the medicine is already subsidized, so you just go and you pay the little and then you get it. Yeah.
Wow. Okay, so some you okay there. More share na Germany health in sense. Okay, and show we.
And Sunrise says, if a woman with no documents give birth, will she and her man get documents? Right. If she gives birth with who? With the man who also doesn't have a document, then they will not get any documents. So if the woman doesn't have documents, the man doesn't have documents, and the two of them have a child together, the child would also not have documents. So the woman and the man would also not have documents. And you're automatic. For the situations where for it's the case where maybe no only obi a won krata na ewu akola no. So only obi a won krata na ewu akola na. Then akola ni ba benya krata because one of the parents no e won krata. Inti akola ni benya krata because also wo ye ne maame anase ne papa no. Would later ba benya krata because akola na nya krata. So that's the chain. That's how it works. But obi ani bin kra akola no so nya bi. Ka say in US and yen use your friend is saying passport by birth. No. I say by blood. Use sanguinis by blood. And you use solely. Yeah.
Okay. Mami share. So be sending me voice note to say say okay, omo person ebi na obi wo ntimi type into there. Mami fa Aisha mami fa me number no. So mo amoni me number no betimi send me voice note ebeba. Na mama Aisha itia ebi na obi wo a refis class me announce ebi na ntimi type wo comment section. O person send obi send a question ebi a voice note. Obetimi the me the number no to screen so. Me the to so a o dey send a voice note number short. Mema mebo show no so na Aisha and responding enti me the number na to so only voice note only voice note Aisha me also be sending me bibi ba me nim say me number na that screen so the voice note only voice note abasa dey say me try say me connect me gadget bi ba enti then biom na mo no be bisa. Okay, Obi bisa question.
Is healthcare taken care of fully in Germany? Yeah, like I said, yeah, in Germany it's they take care of everything. Healthcare cover everything. And so a major operation be it doesn't matter what kind of operation it is, it covers it. So yeah, so every it covers everything. It's just there were exceptions, of course, there are exceptions in everything. When it's something that person you to say I'm funny say what sorry say for example let's say maybe we'll talk do person you of course and no in healthcare no know your would decision now person we are the amount who effect no wow but otherwise I'm funny say or two baby maybe a year crew and now be na was some yeah, you know, the normal bay free. So it depends on on what is, but mostly no, it's for free. Yeah, everything.
I mean, what voice note to say everybody no work at check here.
Eba.
It's ya abusuafo nyinaa ne wɔn a wɔtie nyinaa mpɛ sɛ mebisa sɛ moyɛ family insurance no ansɛ sɛ ne yɛka insurance no asɛm sɛ moyɛ family a ɛno nso ɛkɔɔ so anaa na sɛ ɔbaa no nyɛ adwuma but bɛrima no na ɛyɛ adwuma nti ɛwɔ sɛ bɛrima no tua ma ɔbaa no ɛyɛ a ɛkɔɔ so anaa mpɛ sɛ mebisa ɛno nso ɛna afei nso sɛ ɔbɛrima no etua no mu anaasɛ akyire ɔbaa no nso bɛnya adwuma yɛ a yɛbɛtie firi ɔbaa no adeɛ mu anaa still na bɛrima no na ɛbɛkɔ so atua ɛda mo ase.
MCC what's here?
Yeah. So family insurance, no, so far as I'm concerned, no. So Obama, like you said, no insurance. So far as I'm concerned, the price doesn't change. I mean, maybe a big kakra account for you or Bano to join, but any 100%. Your family says €100 a month, and 200. No, maybe bibi kakra no betua aka ne de no ho na akava wo oba na wo ye ne yere no na wo da insurance ne so nkola ne so ba be da insurance ne so if the man in the ejuma. If it gets to a point where oba so no anya na ejuma, then she wouldn't need the family insurance again. So no aba benya insurance because on so any ejuma, but it depends on ejuma or yeah. If it's mini job, I think say no still bet me other ukuno family insurance so. But so when you ejuma, you find say we part-time job and now we full-time job. If you ukuno insurance so now wa babe that wa insurance so like wa obenya wodi utia na wo employer and utia part no na wo insurance no. Nkola na you can decide say obeja no mobeja omo ewo Obama insurance this one I say obey you about there so it doesn't matter. Yeah.
Hello, good evening, DJ Nyame. Pacho to me abisa Aisha say I will cano any other one no there one in obey to me because yes say no you Italy per se ba on.
Okay.
And I'm Pacho the cancer Koda hospital. Maybe 1 week on mono over to 70 euro and no over to our front desk on the hospital na. Thank you, danke.
Aisha, what's it?
Yeah, what was mete Aoka me personally me ni Aoka. I know say Nkofo be Aoka so but me compare Aoka to me insurance na me that's na me find me insurance no better because I'm cover so many things as compared to Aoka and the price too is relatively okay. Me what TK taker technical cranking casa. And for me it's good. You can try that too. Many advert Emma taker, but yeah, you can look at that too. And now say barman so you can look at it too. So would you be other TK so that meaning say na Aoka ejuma, but so would you be other TK so that's what introduce you usually normal 50 euros. Inti you can consider that only be other so a bit meaning now I say no refer now when 50 euros. Why? Anyway. And about Tikana Yetuano. So like I said, a paushal, that means a fixed payment, just 10 euro per day, so called the hospital. For hospital no just can health insurance, hospital no 10 euro per day. Into 1 week, that's like 7 days, about 70 euro. You don't pay that money at the rest you bet discharge you wako fee. Na so akoda wo we ye be discharge wako fie na no ma send no receipt almost a new receipt receipt no I know now debate here. That's how it works. Sorry. Igenya mewie
kwala ni mi me pacho wo me question bi mu ni se na me bisa se na sister Aisha chichi mu nkrata na se oba no won nkrata na wo ma mienu na kwala ni mienu won nkrata na so hia be ma foforo wo mra onya adwuma da na oda social na job center so na wo hia be ma foforo na be ma ni nkrata no eno me pacho ne be ma no wa oba no betumi di ama no ana se ho so oba ne adwuma ansa na be ma ko na se nya biama me pacho me das
Igenya pacho voice note ni biom me man shada and get
pacho me question biom ni se na me bisa se na sister Aisha chichi mu nkrata na se oba no won nkrata na wo ma mienu na nkwala ni mienu won nkrata na so hia be ma foforo wo mra onya adwuma da na oda social na job center so na wo hia be ma foforo na be ma ni nkrata no eno me pacho ne be ma no wa oba no betumi di ama no ana se ho so oba ne ya adwuma ansa na be ma ko na se nya biama pacho me das
so then it doesn't matter. So who on krata now only will be a bema owning krata wo like I said, it doesn't matter say I buy an extra one. I say one person now usually no say bear money in krata because who want krata no akola na only bear man na automatically akola ni benya krata because who want krata. Once akola ni nya krata no papa no akola ni papa and so should get in krata because that's how family works, right? The family has to all say baku on krata. That's how everybody gets it. It doesn't matter say we are juma and say uji a bicycle. Usually no bear man so benya krata no. Yeah.
Yeah, DJ. Me checha mo. Only Mami Aisha. Nobody man. Me shamo pa. Now we say about travel insurance. No. I'm saying the what Ghana no. Omoni insurance ni ho. If it's a cabo of ho. Ufra mo ese mo receive. Just also no means mo reply. Lady Biba has a the tono. Na kabe 1,007. Let's say umutia. So. Nti this year na ya no mota state is so be ba at least no unya German dey na better and no yen ka say tia na coffee na because German here and cover up to all the European countries would they visa na
Okay, I think Matthew Nana Osani voice note way. Mami put it BB across. I think say Obide comment section Obi bisa. And I can't help too, but take away. Say a random question.
Okay, I think before I take this, the Matthew kind. Okay, yeah, because I know say now I'm gonna ask a lot about AD insurance. And I know what Germany has said they ask, but yeah, that means it will be better question about how so new be what has said to do the insurance because I know tell euros no. Yeah. So anyway, so yeah. But your question, Echo.
DJ, me pacho over to me akache Aisha say me na me sending message ni say any me number ni say me person me ni kasana on chere me areas over to me atina no but on frame me.
So
I'll say what send you a message say areas be up with me at any idea.
now when he Germany ha.
I think so.
I said, okay. Germany has obet Martina baby. Doesn't I mean he has opened obet Martina baby. I say you need typically white communities, typically black communities with I say in Niha, so you can live almost everywhere in Germany.
Okay, then take a question on screen. So one more questions. Yeah, I'm maybe san and chair 12 minutes. Yeah, signing out. I shall screen you say uncle.
George say, please, I want to know more about obligation letter for someone who wants to study in Germany. Who qualifies to sign for someone? Who qualifies? If you're working, say you're working. If I don't want to say how much money you should have in your account, but so if you have a full-time job here in Germany, usually no, you qualify to sign for somebody to come. Don't forget, say. Yeah, but usually say salary should be at a certain point because nipa na will sign your man no. You're looking at sika was all man monthly. See, the money you should have, the person should have, it's now around 860 euros, I think, monthly. So you should consider Juma full timer. How much are you getting at the end of the month? So 860 if can so that's what the immigration would consider. So your obligation letter will be. That's what Tombe consider. And Tianfani say we now salary 1,000 euros. This is just an example. Nanipa na will sponsor no or ban ni monthly sika on here they say for the upkeep no 860. Then clearly you can't sign for the person to come because that means say Unipanuman 860 new at the end of the month na kawahe akaw a 140 yeah, so it depends on sika unya, but then mostly if you're doing full-time job it should be fine for you to sign for somebody to come. Yeah. Ima Owusu. Emma. Okay, doesn't matter. Please, if I'm in Spain and want to give birth in Germany, is it possible? If you're in Spain and you want to give birth to Germany is a free country. You can come and give birth. Only problem is that you would pay for your own birth cost. So you should be looking at depending on what birth it is. If it's a spontaneous birth, or more can it's a natural birth, you should be looking at up to or at least 5,000 euros. If it's cesarean, you should be considering close to 10,000 euros. This is what you have to be able to give birth here. Because you need a health insurance, so you would have to pay for it by yourself. Yeah.
Obviously, you know, obviously, your performance, no.
Godfred Owusu, what are the best reasons to get a positive asylum decision as a Ghanaian? Asylum.
Obanyo Jena.
As some way they are serious. Like me reason obviously they are asylum. I think so me kind of generally to be from Ghana, it has to be political. It has to be political, and you have to be able to prove it. This is the only possible way you can get asylum here. Yeah.
No work no. So questions beyond Babioma. Obviously, I want to go to Germany for a visit. And you know.
Please, I want to go to Germany for a visit. Okay, then come. Come. Go to the embassy and apply for a visa. A visit visa and come. Why? Germany is nice. Come.
So many questions be beside me. I'm signing out. So me there Thursdays be I'm in from 6 to 7. He said, "Oh, what the questions be bana? One fan, but Obi Sam say, what is this? Meaning what I hear? Then look at visa. Senor, look at visa. OGB, daddy.
OGBYN. Then. What was OGBY? Is it not the same as your friend is saying? GP, general practitioner. It's the same. I think says sometimes in the UK Omuka OGBYN. What about it? I think I mean if I'm right, I think it's the same as medical. Your friend is saying your GP, general practitioner. And I said no. Are you talking about something else?
Me Anyway, so mention comment section. You can take it where.
Nuru Ado. Asylum, please, what are the available routes for medical laboratory scientists to come and work in Germany? What are the available routes? Nuru, I think you should, maybe you missed our show before on the links on Make It to Germany, blah, blah. Go and look there. I think that you should be able to find stuff like that. Otherwise, for people in this kind of field, especially when it comes to the medical fields, you would need the German language. It's very important when it comes to the German field. I think I mentioned it, medical field. I think I mentioned it some time ago, say, if we're looking at certain fields, like, I mentioned the IT people, they don't need any German. They work 100% in English. But when it comes to the medical field, you're going to be looking at people who are coming to you are people who speak German. So here you would need at least, I think for them, I think if you have B1, it's okay. You would need the German language to be able to work in this field. But if you manage to learn the language, getting a job would be very easy here. Yeah.
So Bibi and Yobioma. Also a nursing assistant.
A nursing assistant employable. What is a nursing assistant? I'm trying to figure it out. What is a nursing assistant? Do you assist the nurses, or meaning? Can you put it in another language? Is nursing assistant the same as Health assistant. They move friend health assistant. Is it?
Oh, there's a health assistant, nursing assistant, linear assistant.
Yes. I'm trying to figure
it's
out.
Almost one nurses, no. It's almost one nurses.
Okay.
And I said, almost a carer, and now some way be nursing assistant.
Good. So I think that when it comes to the medical field jobs, they need so many people in Germany, Makacho, like so many. I say so many times, that's so many. So if it's employable, of course, you would find a job here. It shouldn't be difficult to find a job. When it comes to the medical fields, Minister of Ajumapa, he's going around the world. Nancy, no, Brazil, on Argentina. When I'm here, Kosho form Bahasia Babesa, medical nursing assistant, Neke, Jumani, or Ninam Noshenko for so 2 of film Baha. So yeah, it's employable, yes.
No say care na.
Yeah.
Okay. And no one have caregivers.
Yeah. That one is hot cake waha.
But I think say and go for be no when I make no e bia na obi so new o e bia fa no we SBTV and now someone subscribing to omunya notification omun hwe programs we ebre na but so you new they are fine many Aisha here oko channel no so na oko live your videos near all live oko live no so bon say previous many na here enyuma website to cry ya kan obetimi apply obenya sharp obekọ Germany sisi a ni nyina kan ni nyina ho. And it's a question say am be say e bia no be new say say Facebook am joining or YouTube and am me see a lot on na feel ani nyina wo me say Denzel Buache be subscribe to your YouTube boy na action na no and na dey e bofre mu na me dey aba Facebook and Aisha I think say for now no that's why your time so I got 3 minutes near upon omo me dey buy nya hwe obi say wow, I want to marry you. Hey, Obinidi share not you no onye. Mo dem so ya. Mo dem youth na maba no. Mo so mo na mo social media. Na se mo man for block mo inbox ni ade because sanya mo we na mo disturb you no. Last time be so are na TikTok no we mo bra say chale message umu obi ya you say you want to marry I want to marry you. Just rough. No be something like you take ground. You want marry how? Hey, I don't want to talk some things. Make I leave one for you like that. We are worried about your or we crunch. Obano ready saying?
2.
2. 2 person go worry na kan one na. Boy not try no we went saying. Denzel, you want marry and join? Aisha, you better so pass it through SBTV Africa. So I mean, why are there? Next week I mean I do my best share be on a different topic. And more I'm missing me na programs and a bit jai for some time. We call you live now. Or no me live. It's call live now. We call SBTV page. You click SBTV ne bia. Na I mean me educating for kakra bi mo nim. So type SBTV page. Oh, search now. Unsubscribe here. Obo SBTV Africa no so a obon sa show home videos shorts live playlist community channel and about atro into the other end say because me no live no any doctor with lawyer wisdom akaho UK live no oko videos a obebre into the call live no so be actual live no o click so a obon me live streams amaye into obon me ni Aisha okoma me ono ne lawyer in the life into come obon say me no program no and obon in temper okọ ya obon ono in temper into just follow okọ ya channel no SBTV buy ya na click logo na aba no so na obon say atro home videos shorts live click live no so under 8 no obon say me na previous videos wo ba ko na can say obon say new German laws for job searching any actual visa for third world countries. Yeah, the program in about a month ago. Into mon check is very important. Why? But I'm saying SBTV Africa. Aisha, Charlie, Akpesia. Okay. Madam and some SBTV Africa. Ring photos me that say Denzel Boache me that say from Facebook, but Johnny or YouTube Steven Tretu. Me that say Nuru Ado, Prince Ali Baba. Thank you so much. Ima or Emma Usu. KD TV, thank you so much. Esther Odai, thank you so much. George, thank you, George Danso. Thank you so much. Godfred Usu, nice one. Senor, thank you so much. I think that's all. Answer Bright, thank you for watching. Cynthia Dufie Owusu, also good job. Good job, DJ Nyame. Thank you so much, Cynthia. Afi M Enyonam Akpe Esia Amoatin Elisha, thank you so much. Paul S Mambulu. Hey, also, can you speak English? Hey, brethren, you will speak English here? We're gonna speak English next time. Don't worry, okay? Okay, so Slidongba, thank you so much. Christian Pereira. Also, we say why not? Also, why not the health care about our motherland Ghana? Why, Maza? Why we Ghanaians no dey abroche. Ghanaian health setup TV plenty they do health talk about health for you. We too the Ghanaians where they dey abroche we won't talk about them health. You can't write say we by force for talk everything for Ghana here. If we people will talk, everybody go listen. I mean, then plenty they will talk about health, plenty TV and things, health everywhere. So this one be Obodo Igbo Ghanaians where they did there we talk about. Thank you so much, guys. Anyway, I'll to say watching straight from Israel, Tel Aviv. Big shout out to you. Thank you. Thanks to my production team, DJ Click, Sharon, and Tina. Like, share, subscribe.
Oh, hello, people. My name is Kale Boss. The only boss. Oh, wait, what is? Have you heard? Wait, do you know that Tap Send is live in Texas? Oh, you didn't know? We went to New York. Now we are live in Texas. So people in Texas and around, all you have to do is to download Tap Send. Yes, Tap Send has become the most unique, secure, and fast way of sending money across the world to your loved ones anywhere. Okay, so download Tap Send on Google Play Store or App Store. And when you're in Texas or around, you just have to put in the code TXGH. What did I say? TXGH, and you get $10 for your first transaction you make. Mahama media, Texas, you drew very soon we'll conquer everywhere.
Download Tap Send now on Google Play and App Store. Tap Send, it's secure, convenient, easy, and fast.